My name's Clare Linger and I'm one of the quality improvement leads. And I'm just going to speak to you today just a little bit about how the QI team can support services for some patient-led improvement work. So one of the teams that we were working, and they came and asked us for support in improving their service for patients with laryngectomy. So for those who are not sure, a laryngectomy is where you have your voice box surgically removed as a treatment for cancer of the larynx. So we used a framework from the Point of Care Foundation. This is an evidence-based co-design framework. As you can see, it's quite a simple flowchart with various steps along the way. So we started with patient and staff interviews, just asking about what was good about the service and what sort of areas that they felt could be improved. And during these interviews, we had support from some occupational therapy students who were on a NELF AHP leadership placement. And actually, that in itself, we couldn't have done it without them, and the benefits actually of having students from across profession. I probably could do another presentation on it. It's great. Once the interviews have been done, we themed the answers, and then we held a patient event and a staff event just to kind of clarify what those themes meant and to start thinking about what improvements could come from those themes. And then the final point was bringing everybody together for a patient and staff event where we could really sort of like thrash out those ideas as a group and then vote on which would be the area of improvement that the adult speech and language therapy team would take forward as a project. So, it all went very well, and thinking about, on reflection, about what we would have done differently or what we've learned from following this framework, I think the biggest thing was actually about keeping open those channels of communication throughout the whole process, not assuming anything. So with all your stakeholders, patient, staff, that you communicate with them. So where this reflection came from was when we did the patient event. I met with the clinical lead for speech therapy, and we talked about what might be the barriers for the patients not coming and supporting this type of work. And we talked about having a venue that was sort of central to where they lived. Was transport an issue? Could we pay for taxis? Do patients need to be paid to come and do some of the work? Refreshments offered? All those sorts of things. And we put various things in place, and we had the event, and very few people came. And it was really disappointing because we put a lot of work into it, and it was a shame. But we didn't give up, and the speech therapy clinicians went back to the patients and said, during the interviews you were really keen to support us, why didn't you come to our event? And the answers they gave us was nothing to do with where the venue was or whether they were going to be paid. They said, actually, I'm afraid of talking to a large group of people. I'm scared of meeting strangers in case they don't understand me because of my laryngectomy. I haven't left the house since I've had my surgery. So actually things that, really understandable. We also spoke to some staff, and we wanted to engage with staff outside of NELF that were part of the London Cancer Network. So the surgery is done at UCLH, so we wanted those staff involved with this process as well. And they said, actually, it's a bit too far for us to come. So we had to think about that as well. So when we did the patient and staff event, we made it hybrid so that staff or patients could join virtually if they wanted. But the main thing was when we sent out invites, we made it really clear about what was going to happen at that event. So we spoke about the fact that there would be small table discussions, that everybody in the room would either have a laryngectomy, they would be a carer or a friend of somebody with a laryngectomy, or they'd work with people with a laryngectomy. So it was a safe space for people to be. We said, we'd have paper and pens on the table, that if you wanted to write things down, if you weren't confident speaking, you could write things down with post-it notes. that you could bring any of your sort of network, so they could bring friends, family, you know, anybody that made them feel more comfortable to join in the discussions. And on this occasion, we had a room full of people, and it was such a good afternoon. And we had people from NELF staff, we had patients, families, neighbours, carers, we had students, we had commissioners, staff from the other hospitals. You can also see we've got the laptops on the tables, and they were the people that were joining virtually and having the discussions at the table virtually. And it was a really brilliant afternoon, and we came away with a goal of working on part of the pathway. There was a transition from hospital post-surgery to that kind of that first few weeks after, once you're home. And one of the speech and language therapists is now going to take on that project as part of her QI facilitator training and work with the patient to see what improvements can be made as part of that pathway. I'm just going to finish, so that was how I felt about the day, and I felt that it was a real success, but actually to hear from the patients as well. So we've just got a very short video from a patient and his wife about what he felt about the day.
For me personally, I found it very interesting. It's wonderful that you're going to get the views of the actual patients as well as the staff that work on it. And having all the views together, I hope it goes around really well.
Thank you.
Yeah, I think it's been great to have the opportunity to change things for future laryngectomy patients. You know, things like the problem with dealing with bits at home on your own are all going to be addressed now, and there's the combining of the views of the staff and the experiences of the patients seems to be a really brilliant way of dealing with that, and hopefully going forward it's going to be improving the service all over the, Salt and everything from the hospital downwards.